Hi, I'm Dr. Russell Faust, Medical Director here at Oakland County Health Division. Thanks for visiting us to review the ins and outs of rabies vaccination as well as rabies immunoglobulin RIG administration. So I'd like to today briefly cover wound care, whom to vaccinate, whom not to vaccinate, how to vaccinate, really, and some notes on RIG. I'd like to really start out and focus on post-exposure wound care. Note that the rabies virus is particularly fragile and is susceptible to simple soap and water. You must thoroughly wash and flush any animal bite wound for 15 minutes with soap and water. It is also susceptible to various virucidal disinfectants as listed here. And note that bleeding from an animal bite suggests that there is deep embedding of viral particles in the wound. So, must be thoroughly flushed, washed with soap and water. Use any virucidal that you have, and in addition, you must infiltrate the wound with the RIG, and we'll get to those particulars in just a moment. Finally, depending on the source of wound, consider antibiotics, consider tetanus vaccination as well. Please avoid suturing an animal bite wound in the context of rabies exposure if at all possible. If you must suture the wound, let's say it's so extensive it needs some suturing, then you must infiltrate the wound with RIG. And again, we'll get to that in just a moment. Folks who do not need rabies treatment, they do not need vaccination if they've been bitten by a rodent other than a woodchuck, a groundhog. We have had a rabid woodchuck here in Oakland County, so there are no treatment for squirrels, mice, rats, rabbits, etc. Anybody bitten by an animal that is available to quarantine, and by quarantine I mean sequester from exposure to other animals and other people for at least 10 days to make certain that animal remains healthy. If that is possible, that person does not need to begin the rabies vaccination series. Anybody bitten or exposed to an animal that is available for rabies testing does not need to begin the rabies vaccination series. Folks that do need rabies vaccination, anybody bitten or scratched by a wild animal, bat, raccoon, skunk, woodchuck, stray dog, stray cat, and by stray dog, stray cat, I mean any that are not known to the person and are not available for quarantine or testing. Anyone sleeping in a room who awakens to a bat in the room, whether that's a child or an adult, anybody. You awaken to a bat in your room or your tent or your cabin while you're out camping, you must be vaccinated. Any child or any individual who is disabled or intoxicated who is found in a room with a bat, that is, they cannot reliably articulate whether they've come into contact with the bat, must be vaccinated. Rabies post-exposure prophylaxis should be begun if exposure is suspected. Even if this person has presented long after the potential exposure, they show up weeks, for example, after being bitten by a potentially rabid animal, you must begin vaccination. Appropriate wound care, again, can significantly reduce the viral load. I need to emphasize aggressive wound care, thoroughly washing and flushing the wound for 15 minutes with soap and water, using any other virucidal agents you have access to. Now, the administration of PEP, the schedule is as follows. Here's the graphic representation. Day 0 is vaccination number 1, day 3, number 2, day 7, number 3, and day 14 is the final number 4. There is only one instance where there is a 5th vaccination, and that is for anyone who is immunocompromised. And here's the graphic representation of that. It's the same as previously shown. In addition, there's a 5th vaccination on day 28, only for those who are immunocompromised. Anybody who has been previously vaccinated, that is, zoo workers, employees, any veterinarians, etc., there are only 2 treatments, day 0 and day 3 for vaccine 1 and 2. Now, important notes on RIG, rabies immunoglobulin administration. 4 known exposures, bites, scratches, wounds. Infuse the full dose of RIG around the wound if there is a wound. Some areas, fingers, hands, wrists, ankles, maybe neck, maybe face, can be very difficult to infuse a full dose of RIG. And RIG dosing is based on weight, of course. So the larger the person, they may still have relatively small fingers, considering the dose of RIG, the volume of RIG that is required. So in those cases, infuse as much as possible around the wound, give the remainder in that extremity. It is intramuscular injection. Do not give rig and vaccine in the same limb. So if, for example, they've been bitten on the foot, infuse with rig on, say, that extremity. Vaccinate on the contralateral deltoid intramuscularly. If rig is not available on the first visit, it can be delayed up to 7 days from the first vaccine dose. Now, here are a few other tips quickly. Again, do not administer rig and vaccine in the same extremity. Do not administer rabies vaccine in the gluteus. I'm not sure why CDC insists on vaccinating any place else except the gluteus, essentially. They prefer deltoid intramuscular. Inject rabies vaccine IM deltoid. Rig can be administered in the gluteus, but you must be certain that the needle is long enough that it reaches gluteus muscle. And again, do administer vaccine distant from the rig injection site. If you strongly suspect an exposure, especially if there is a bad exposure, the bad is not available, then you must begin the vaccination series. Don't wait for lab results. In general, you can wait for lab results if we have an animal available for testing, because the vaccination series is extremely expensive, and of course you'd like to minimize that expense. Note that you can prevent rabies infection, that is rabies exposure, from becoming manifest as a rabies infection only during the incubation period. There are no contraindications to PEP for rabies. Not pregnancy, not infancy, not in the elderly. There are no contraindications. Any bad exposure is considered a Category 3 exposure, and according to CDC and World Health Organization, warrants vaccination and rig administration. Those are the particulars for managing rabies exposure with regard to wound care, whom and whom not to vaccinate, some notes on rig, and I appreciate you coming by. Thanks again.